We're back. Wellness Week, day 3. And we've had a great lineup so far of speakers this morning. But now we're bringing in one of the icons of the functional medicine industry. Did you like that, Doc?
That was
You're an
pretty good.
icon,
Thanks,
buddy.
Joe. That
This
was
is
that was a
this.
sweet little roll in.
It is because I've been reading your stuff and it's brilliant. So this is Dr. Charles Benz, everybody. He's coming to us from Sarasota, Florida. He is a professor. He's an international lecturer and an author, and it doesn't end there. But what is so important about what he's going to bring to us today is we have, of course, still the number one killer in the world today is heart disease. How do you recover from an event? Okay, a heart disease event. That's number one. But what he has also done is shown a correlation to recovering from both heart disease events and COVID events because of the similarities in how the body reacts and how the body is affected by both of these. So, without further ado, Dr. Charles Benz, welcome, my friend.
Thank you, Joe. It's an honor to be here, and thanks for the great introduction. I think that we have some interesting information for people because repairing what we know as DNA damage to cells is not the easiest thing in the world to do. Very few people have pretended that they could make it happen, but we did it with the COVID and got all the cells to be repaired that were damaged. And I thought, if we can do that with COVID, why can't we do it with heart disease? Why stop with that virus and the damage that it does? Because the heart disease that's there for 800,000 people a year get a heart attack or a stroke, and so those cells are damaged, and we need to try to repair them. And so we've come up with a program. We think it works. People have to be disciplined and do the right things about their diet and their nutraceuticals. But if they do it, then they can have a chance of getting that repair done in their bodies and have a longer and healthier life.
Well, and that's great. I'm glad that you presented it that way because it's never just a pill for an ill, is it? It's a lifestyle change that incorporates therapeutic nutrition.
Yeah, I mean, when we look at chronic illness as a kind of a package of illnesses, there's a certain number of things that always are present in terms of causing this chronic illness. And we see there nutrition and exercise and stress and toxins, which includes radiation, and poor sleep patterns, and genes, of course, are a factor, and hormones. We give those 7 things the biggest items in the whole portfolio of things that cause chronic illness. And so if we can concentrate on those things, then we have a better chance of preventing chronic illness and repairing it when it does happen. I mean, when you look at heart disease alone, look at all the things that can contribute to heart disease. I mean, if you have high blood sugar or high blood pressure or LDL cholesterol is small or low, if you have low levels of HDL cholesterol, we've always said that cholesterol is the number one cause, and that's what the conventional medicine focuses on. But we know there's other things that are even more important than cholesterol. Cholesterol's there like at the scene of the crime, repairing the damage that's done. And so if you have blood vessel free radical damage, that's where the cholesterol comes in and tries to patch that problem up if there's been a
Right.
damage to the cell somewhere. So if you don't have sufficient levels of vitamin C, which is the antioxidant that has an extra electron, then you're going to get this damage. But if you have enough vitamin C in your body, that damage doesn't really happen because that repair is avoided by having that free radical neutralized before it does damage in your cells. And so some of the other things are hardening the arteries and plaque buildup and having too much saturated fat in your diet and having high homocysteine levels and high C-reactive protein, which is inflammation levels, and high stress levels, which is cortisol, and low vitamin B and low exercise. We also point out that high exercise is not good because if you exercise too much without the right nutrition, you actually produce oxidative stress. And then, of
Right.
course, the COVID-19 infection and vaccination also have been known to cause myocarditis. And blood clotting is now considered to be one of the number one things that causes heart disease and heart problems in the body. And then the spike protein is related to the COVID-19 situation because the spike protein is the carrying agent for the vaccine, and it's now known to replicate and cause damage within the body aside from what the vaccination does. So these are all factors that contribute to the cause of heart disease. And if you're wondering whether conventional medicine has anything to kind of counter this, I did this slide just as a kind of a test to say, okay, uh, can this damage be prevented and reversed? Well, okay, yes,
Uh-huh.
the answer is yes. And then, the body has 7 different repair strategies or processes that can be used. It's in our DNA. We're actually programmed to repair this damage. All right. So conventional medicine uses statin drugs and angioplasty and stents and bypass surgery. And they do get into the low sodium and the low fat diet a bit. And they also say stop smoking. And if you have high blood pressure, take your high blood pressure medication and try to lose weight. And if you have blood clots forming, try to use medication for that. The answer is, though, are these strategies going to actually, that are damaging the cells, are they going to actually repair this cardiovascular damage? And the answer is no, they will not
Yes,
repair this
you're
cardiovascular.
right. It's a flat out no. And
We have
even
a
on doc, even on those procedures, low sodium, low fat diet, for example, we're talking about table salt, which is crap. It's not really any, it's not good sodium, right? It's
right.
filled with all kinds of things. Himalayan pink salt is a totally different issue. And
Yeah.
when they say low fat, they're not distinguishing between good and bad fats in the diet. Yeah, you got to get rid of those trans fats from all the fried foods, but you still need good fat. So it's even when they might be on the right track, they still miss the point.
Yeah, it is disappointing. You're absolutely right. And so I think medicine is ready to start a turn in this direction because we're getting so much evidence now. The evidence is so overwhelming in favor of these functional medicine science-based strategies. And I hope that we can get your viewers to take a look at this and spread the word on it and tell more people about it because a lot of functional medicine doctors don't know enough about this also. So this is going to help a lot to make sure that they're all united in their understanding of how this can happen.
Oh, I agree 100%. The DNA damage, DNA damage has been long accepted as one of the premature causes of aging, but that's about where it ends. I mean, the details and on how to either prevent or reverse it, that's where it gets lost.
It does get lost, and yet in a perfect world, which our bodies are designed in such a way that if you have all these systems in place, you see there's 7 different systems for repairing this DNA damage. All right. And so if you see that these are pathways that do something different, each of these pathways has a goal in terms of repairing this damage. And so if you have these pathways, most of the repair occurs in what we call the ongoing repair and replacement process. All the cells in the body are replaced, some at a slower rate, some at a faster rate. But the main thing to remember is they're all designed to have some repair done on them at some point in time. And so we know that that's possible. And we know that there's a lot of damage taking place. People say, well, how much damage is there every day? Well, in the next slide, what you can see is there's 50 to 100,000 cells that are being damaged every day. 50 to 100,000 cells in our bodies are getting this DNA damage. And so you look at the
Mm.
reasons for that. Well, there's the chemicals in the air and the water and the food we eat. There's radiation from cell phone towers and cell phones themselves and televisions, computers, and electrical. I won't even put an electric clock next to me in the bed because there's electromagnetic radiation coming out of that clock, right? Overexposure to the sun, smoking or consumption of alcohol, chemicals used in the home and in the office. I mean, the amount of chemicals that we put out every day in the cleaning appliances that we use are just ridiculous. And then there's X-rays and CT scans and all the electromagnetic radiation that occurs in the hospitals and the doctor's offices is absurd. And the most important one is the consistent nutritional deficiencies. And so you look at all these things, and this is why there's 50 to 100,000 cells that are actually being DNA damaged every day in all bodies. I mean, this is right across the board.
So, Doc, let me ask you something. Go back, Phil, to that last slide. If number 7 isn't there, then we have a better chance of combating a lot of these other causes of DNA damage. Now, some of them, are self-imposed, like smoking, consumption of alcohol, things like that. But if we had a perfect nutritional balance in our life, we'd be able to combat these a little better, wouldn't we?
Oh, absolutely. In fact, there's a nutritional strategy for reducing the damage from radiation. There's detoxification that can be done through nutrition and nutraceuticals. So you're absolutely right. We can neutralize these things and do a lot more about it. That was a great point to make. So that people need to know it's not just about the heart disease. It's about any kind of damage that happens that can be repaired. And so that's really the way to look at it. Um, Now, if you have this, we do a sort of a picture story here where you have all these different causes at the top, and you have the DNA damage, and then down on the bottom you have all the repair processes. And so we know these things are in place, but look at this: about 90% of people consume low levels of nutrients. About some studies as high as 95%. But vitamin C, vitamin D, 70% of people have deficiencies in vitamin D3, zinc, and there's a whole list of them. We'll get into the bigger list a little bit later. There's too many chemical toxins in the body. I mean, the amount of chemicals that are developed every year is unbelievable. And so we're in this in our water and our air and our food. We're up to our eyeballs in toxins, and we don't even see them. We don't even smell them most of the time. Radiation is everywhere. It can't be seen. It can't be smelled. People don't even understand that it's there doing its damage. People depend on over-the-counter medications and prescription medications. Believe it or not, the liver says, wait a minute, these are toxins. We don't recognize these. These aren't natural. So the liver has to detoxify all of these things. And then the free radical damage in the body ends up from all these different chemicals and toxins ends up to being about 5 to 10 times higher than our ability to repair it. In other words, the overload of all the toxins and free radicals in our body is so high, we just don't have a chance to really do the repair that's necessary. And here's one of the best slides in the whole presentation, in my estimation, because people don't really understand how this whole cell replacement process works. But there's about 4 checkpoints. So you go to the first checkpoint, and then all of a sudden the body has this system where it says, okay, let's do a check here. Are there missing hormones? Are there missing nutrients? Are there too many toxins? So they're taking kind of a stock of what's going on. All right. And so if you have that happen, then the body says, okay, wait a minute. We don't want to go on with this replacement process because you're not ready to replace this cell with a healthy cell. And so you can even have the presence of viruses like the Epstein-Barr. And 95% of people have the Epstein-Barr virus in their families as a latent virus. You've got stress. Everybody has stress every day in their bodies. And so this exposure causes these cells to slow down this process. And you would think that it would slow down just a couple of minutes or a couple of hours. It can take days for the cell to decide to go to the next level because it's continually looking for your body to give it the nutrients to need to go to the next level. And then if you go to checkpoint 2, it does the same thing. Checkpoint 3, the same thing. So there's multiple checkpoints. And what the body does, it goes as far as it can in a certain number of days or even weeks and says, look, we're not getting what we need here. We've got to do a patch job. And so they do a kind of a patching job to make sure the cell can still do what it's supposed to do. And then they go on with a kind of a semi-mutated cell. And then eventually it becomes mutated and eventually it becomes diseased if these things don't get corrected. So I hope that kind of explains how this whole
Hmm.
cell replacement process works and how, because of its imperfection, but because the body is designed to let it stall a little bit and delay this process so that things can get better, we're given lots of opportunities, Joe, to get this right. If we don't get it right, then shame on us.
Yeah,
All right.
that's right. Exactly. Now, I love this number three on this list because that's something that I think gets overlooked so often, if not all the time. And that's the presence of this Epstein-Barr virus in a latent stage. But you said 90% of the population,
90,
probably?
95% of the population has Epstein-Barr as a latent virus, probably residing in their spine somewhere.
Wow. And isn't it also, I heard a statistic that 100% of Lyme disease patients also have Epstein Barr.
Yeah, I mean, we think the Epstein-Barr is kind of like the master, the master provider of all these
Uh-huh.
different viruses.
Of all this.
And
Yeah.
so mononucleosis and everything kind of flows out of
Yeah.
that. And
Uh-huh.
so it's the same with the nerve problem that people have shingles. Everything, if you look at it, all those people that have shingles or Lyme, they all have had or have also Epstein-Barr.
Wow.
Yeah, not a coincidence. You're right.
No.
Well, this is all going back to the whole thing that we talked about earlier about the difference between allopathic medicine and functional medicine. So when you look at allopathic medicine and heart disease, you see that they measure cholesterol levels and then they use statin drugs to lower the cholesterol. 50% of people who die of a heart attack have perfect cholesterol. And so if that was a problem, then you'd have like 80 or 90 or 100% that would have this problem. But it's not that. And so it's never been known as the number one cause of heart disease. There were 50 studies done in the early 1950s, and five of them said there might be some connection. 45 said there's no connection. And so they took those five that said there was a connection and built a whole industry, $1 trillion
Mm,
industry on statin drugs.
that's
And
for
so
sure.
it's absolutely insane. They also will
Well,
measure,
Doc, what's
yeah,
even more insane to me is that, and this has been a very passionate topic for me over the years, this cholesterol issue. In fact, I've called it the greatest medical myth ever perpetrated on the American people. But the thing that just the what drives me crazy more than anything else is that when you use these drugs, these statin drugs, and you stop the production of the cholesterol, you start a whole cascade of things, but you also prevent CoQ10 from being produced, which is the nutrient you need for the muscles, and your heart is a muscle. And so you're actually damaging the one organ you're trying to save with this therapy.
yeah, you're absolutely right. And it has very deleterious problems in the brain as well. The
Yes.
number one nutrient for the stopping or slowing down of Parkinson's is coenzyme Q10.
Yes.
And so if you get lower cholesterol, you'll find people will get higher levels of depression and anxiety and bipolar and schizophrenia. And so if they would ever take notice of the fact that these things are happening when they lower the cholesterol too much, they'd realize that this is not the way to do it. Is there a benefit sometimes to lowering cholesterol for 2 or 3 months in order to get it into a safer range so you can let diet and supplements take over? Sure. All right. That's how statin drugs could be used 1 or 2 months at a time, and then get on to the natural production and go forward with
Mm-hmm.
that.
Mm-hmm.
They also will do blood pressure and they'll use ACE inhibitors to get your blood pressure under control. They might measure plaque in the body, and then they might use different things to try to lower the development of plaque in the body. But mostly it's going to be surgery and angioplasty and stents and things like that to kind of just expand the arteries to try to make the blood flow better. And then, of course, there's the low salt and low fat diet we talked about. But in our world, in our functional medicine world, we look at this thing, and this is what the strategy today is going to be based on. 18 separate blood and urine tests to get a full body assessment, because functional medicine is about cause and effect. Let's find out the cause. Let's find out how the whole body is responding, and then let's do a strategy that's going to be based on a whole body solution. And so they will change people to the Mediterranean plant-based diet. They're going to use a series of nutraceuticals to try to lower the blood pressure and remove plaque and help the arteries to become stronger and more flexible. And they're going to use other nutraceuticals to try to actually repair the damage. And so this is the whole difference between an allopathic approach and a functional medicine approach. And so if we did this, we have a good estimate that we could probably prevent and or repair 90% of the problems that related to heart disease and
Wow.
circulation. That's pretty significant.
That's very significant. It's almost cause for malpractice if you don't do it.
Listen, I've said this before. There isn't an allopathic doctor in the country that hasn't done something that constituted malpractice. And
Great statement.
because it doesn't necessarily have to be errors of commission, it can be errors of omission. And in my estimation,
Yes.
90% of the problems are errors of omission. They're not doing certain tests.
Great point.
They're not doing certain nutritional and nutraceutical things that could be done. And they're instead putting in prescription medications that are harmful, have side effects, and don't help the problem in the long term. Now, are there some prescription medications that work? Absolutely. There's a half a dozen or a dozen that I would use if I had to, but 90%, a new study came out last week, 90% of prescription medication trials fail and never go to the market because even their low standards cannot be met through 90% of what they try to put out there. So that's a problem.
That's an alarming statistic, Doc.
Listen,
that really
when
is.
I saw that, I thought we knew it. We suspected that was the truth, and now we find out it's been confirmed. And here's the British Medical Journal, Lancet Oncology, saying functional medicine could stop and reverse hypertension, obesity, heart disease, prostate cancer. This was just one study. And then the Institute of Medicine says basically the same thing. The scientifically proven conventional treatments, along with meditation and yoga and acupuncture and herbal medicine, it's both medically and cost effectively there for anybody that wants to use it. 90% of doctors are not using these tools. So this is a big problem. And one of the cornerstones of this is another one of the slides that I think is one of the most important. The cells in our body go through 6 stages of cellular deterioration. First, they become stressed, then weakened, then challenged, then dysfunctional, then mutated, and then diseased. This is important because later on, I'm going to show you exactly what the test that we use for the cardiovascular repair program, which of these categories they fall into. So when a cell becomes stressed, that means it has too many toxins, too much natural stress in them, not enough nutrition. And so the cell gets hyperactive. It wants to do its job. And so these stress levels come up. You can see them in thermography. Whenever you're looking at the breast health of a woman, you can see 200 cells becoming stressed. 8 to 10 years before a mammogram can see anything. The mammogram needs 4 billion cells in order to see anything. And we're already at like stage 2 cancer by then. So thermography is a good example of stress in the cells. Weakened cells, they just get exhausted. They get overwhelmed with all of the things that they have to do, and they just become very lazy and not as active and not as able to control the things that they need to control. Their functions start to reduce. And then when they become challenged, we actually start to see things happening. Fibroids develop. The cells are actually making some physical changes that we can actually see. And then if they go to the next level, then they become dysfunctional. That's where we have the high cholesterol and the high blood sugar and the high blood pressure and things like that. This is where conventional medicine starts, right here. They don't even look at these first 3. And this is things that are happening 5 to 10 years before this dysfunctional level kicks in. And so they're seeing that and they're trying to do some patch jobs on it instead of doing the real repair. If they don't really solve that, which we saw from our early example, they don't, then those cells start to become mutated. In that exact sample where we said this is how we replace cells, the cells have a chance to do it, and they try over and over again to get that repair done. If they can't, they move from dysfunctional to mutated. And if too many of the cells become too mutated, too much DNA damage being done, then they're eventually going to go to the disease state. This could take 8 to 10 years. In some cases with radiation, it can take much lower period of time. So this is the problem that we're facing. They're not understanding this repair process.
Wow, Doc, that is truly an amazing slide as well. I love that slide because, as you said, they bypass the first three steps. They're never even addressed in allopathic medicine, and I've we've talked a lot in the past about what happens when a cell either becomes senescent or it goes into apoptosis and premature death. But the senescent cells are actually the more dangerous ones, aren't they?
Yes, they are. I mean, their cells being killed every day, and it's part of the normal process. But sometimes they don't relieve the body as efficiently as they should. And so we actually need to increase the ability to remove those. And we do that in our program. And so that's what's really great. So that's a great point, Joe. I really appreciate that. Um, we've actually got a nutritional disaster in this country. This is the land of plenty. I mean, we have more opportunity for good food here than any other place in the world, and yet we have some of the worst nutrition of any place in the world. And you looked at it, the COVID, there were only like 10 countries that were worse than us out of 150 countries in terms of the death per 100,000 people. And so one of the countries, Japan, had 219 deaths per 100,000. We had 2,200. So Japan ate better than we do, and a lot better than we do, 10 times better than we do, because
Mm-hmm.
we ended up with 10 times as many deaths from COVID as Japan did per 100,000. All right.
Mm.
So when you look at this study from the National Cancer Institute, 16,338 people aged 2 to 80, they could not find one person with a healthy diet. Not
Oh my
one.
God.
And in 11 out of 14 nutritional categories, people were seriously deficient in 11 out of 14 categories. So people who think they eat a pretty good diet and say, "Oh yeah, I ate a good," they're blowing smoke. It's delusion. That's the
But
problem.
Doc, when a person goes into a hospital with a cancer, they feed them the standard American diet
And worse, anything.
and worse.
Yeah, if you go to some of these cancer clinics and you say to people, "All right," they say, "Doctor, what should I eat?" And they say, "Eat anything you want. Doesn't matter." That's absurd.
It's absurd. Yeah.
So poor nutrition is the number one cause of chronic illness. Everybody kind of agrees with that. And over 90% of the population has a weakened immune system. Although the thing that I mentioned before about the number of people from Japan that have died because of COVID versus 10 times as many dying from the COVID in the U.S. And so this is really a sad state of
Mm.
affairs. Um, Patrick Holford did a study of the American diet. He's a British nutritionist. And when they looked at the average diet and the good diet versus the RDA and what we call the ODA, which is the optimal daily allowance, and you look at the shortage between the good diet and the optimal daily allowance, look at all the deficiencies. Vitamin E,
Wow.
85% deficient. Vitamin C, 90% deficient. All the B's, 85, 85, 41, 80, 93, deficient. And so when you look at these, and the only one that's even within range a bit is calcium, and that's because we drink and eat too much dairy. And so we have all this dairy in us that's doing other problems. And yet, in terms of meeting our daily requirements, we're doing pretty good from a calcium point of view because of all the dairy people are eating. But in every other category, they range from 30 to 90% deficiency.
And that's using the ODA, the optimal daily amounts, right?
Yes, the optimal
If you
day.
use the RDA or the ridiculously dumb amounts, then it's worse.
Well, no, yeah, they actually have lowered the standards so low that the RDA doesn't look that bad, but the RDA is the minimal. It's the minimal, and whereas the ODA is the optimal. That's where disease is actually measured. RDA 60. Well, now vitamin C has gone up to 90 milligrams. When the slide was developed, it was 60. But 90 milligrams of vitamin C, that will prevent scurvy, but that's about it.
That's about it, right?
It won't prevent anything else. So this is
No,
a serious problem.
it's a great slide, though.
And here's the reason that all these things are happening. People say, well, why is that happening? Well, the soil has been depleted from over farming. All right. Farmers don't add any of the necessary nutrients. You make a carrot, you need 81 different nutrients. The farmers add three in order to make it look like a carrot, taste like a carrot, smell like a carrot. But it's lost all its beta carotene. Food travels long distances to get where it has to go. It's over processed, which is depleting the nutrients all the time. The people buy the wrong foods filled with fat and salt and sugar. The food's overcooked, which also depletes the nutrients. And the food is not chewed properly, which can reduce the amount of nutrients in the body by about 50%. And so this is
Hmm.
a serious problem. Um, the food we eat and consume is the first way that we can sort of protect from chronic illness, and the cell replacement process is the second. And we talked about that previously. But did you know that if you ate a perfect diet, and we call that like a Mediterranean plant-based diet, you still only get 75% of the nutrients you need to do this repair process. So it's virtually impossible to do this repair process without adding nutraceuticals. So we need them. We need them desperately. Here are the ones that are the cornerstone of this heart repair and reversal damage of strategy that we developed. Vitamin C, vitamin D, modified citrus pectin, which is from the shell of the grapefruit fruit, and we take this modified citrus pectin and we modify it with heat and change the pH. Next thing you know, it's able to prevent cancer and heart disease at amazing rates. The science is unbelievable behind it. Coenzyme Q10, great for energy production. Magnesium, great for energy production. Berberine, which is an herb, great for energy production. The cells need lots of energy if they're going to do repairs. All right. So these are why those three are most important. Specialized pro-resolving mediators, those are molecules from fish oil. And so these resolvins actually have been shown to change the cell from being a damaged, inflamed cell to being a totally normal cell.
Hmm.
And so this is very powerful. This is like 10 times more powerful than fish oil. As taxanthin, that's something from the sea. It's a red. It's a we have the greens from the sea, while the reds from the sea are algae that have powerful antioxidant capabilities. L-taurine is the strongest thing amino acid for the heart, and I think that also great for the brain. Vitamin E is another great one that combines with vitamin C, and this is the miracle one. This arterial sol. This arterial sol is also another one of those red antioxidants from the sea. This actually has been shown to repair the damage of plaque in the capillaries by 60 to 70% within 2 to 3 months.
Hmm.
Now, that's the one that's kind of the magic bullet here, if you will, because we've been trying to do that for a long time with a lot of different things. And
Hmm.
here the study has actually shown the pictures of this plaque being removed as much as 30 to 40% within 1 month. And
Okay, we have to go in a little bit more detail on that. Now, is it coming from the algae as well?
yes,
Okay, so it's coming from algae. And is it in conjunction with astaxanthin or is it a separate nutrient altogether?
they're a separate nutrient altogether. All right.
Okay.
And each one doing something a little bit different, like the astaxanthin, that's actually repairing the damage that's happening in the heart. Whereas
Okay.
the arteriosol is actually getting the plaque, drawing the plaque out of the body and making the endothelial lining of the blood
Mm,
vessels stronger. And so they do two different things. So that's that's a great combination, those two things. I'm really glad you pointed that out. So red things from the sea, Joe. That's where we got
Yes,
to go.
yes. That, and we're in Pittsburgh, but at least you get to take advantage of.
Oh, well, we'll send you some over. Don't worry about it.
Okay.
And of course, the omega-3 fatty acids, very powerful, and they make the blood vessels more flexible, and they're just very powerful in addition. These are the tests that we use. So these are 18 different tests that we use. And so we use vitamin D3. The glycomark is a sugar test. Homocysteine, C-reactive protein is inflammation. This 8-OHGD test, that actually is a urine test that measures the DNA, the accumulated DNA
Ooh.
damage in the body. An amazing test. Galactin-3 is the one that measures how much fibroids are being developed in the body that are deleterious and not good for our heart. And then we have the oxygen meter test. We learned about that from COVID. If you know how much
Yeah.
oxygen is going into your body, you know a little bit about whether your system's efficient. Uh, uh, Cortisol is a measure of how much cortisol is being produced under stress in your body by your adrenal glands. Magnesium RBC is a much better magnesium test than just the regular magnesium test. The MRI plaque view, that's a new software that actually measures how much plaque and whether the plaque is connected to your endothelial lining in the right way or the wrong way, in a healthy way, because you want to find out if it's an unstable connection. That's when you're going to have lesions happen. And these lesions are the things that cause heart attacks. So then we've got the vascular endothelial growth factor that helps to make sure the cells have enough energy to produce new cells.
Mm.
You've got the gamma glutamate transferase, and so that's measuring the liver toxins that are being developed in your body. Vitamin C, coenzyme Q10, fibrinogen, which is a fibro order. D dimer, that measures new blood clots developing in your body. The omega-3 6 balance. They take omega-3s out of the body because it's an oxidizer, and they leave the omega-6s in. So you're ending up with people with a 10 to 1 or 20 to 1 ratio of omega-6s to omega-3s. It's just not right. Excuse me. Because all the omega-6s are inflammatory
Right.
and all the omega-3s are anti-inflammatory. So then we got the troponin time test that measures how fast clotting is going on in your body. That's an important measure. And this pulse test, that's another one like the MRI plaque test. The pulse test actually is about 10 or 20 different items in one sort of compounded test that's actually measuring again whether there's lesions that are forming in this plaque between your endothelial lining and the plaque itself. And so those two tests at the bottom of these two lists are very powerful in letting people know whether they are really risk, because they'll tell you what your risk is of having a heart attack within 5 years based on whether one of these tests says, wait a minute, you have lesions developing here. These lesions could break at any time. And they'll know whether they're serious enough to be a risk of 1 year, 2 years, 3 years, 4 years, or 5 years. So these are really important tests. That's why I included them in this whole protocol.
Doc, let me ask you: are these tests a standard order from most cardiologists?
Standard? No, absolutely
No,
not.
I didn't think so.
Standard? No. That they
No.
you might be able to get a vascular endothelial growth factor test. You might be able to get a D dimer test. You might be able to get the thrombone time test. Uh, some might even go for the homocysteine, and some may go for the C-reactive protein. Those are 5 of them. But you know what? The other 13 almost never happen. Almost never
Explains a
happen.
lot. That
Yeah,
explains a lot.
yeah.
Yep.
And so here's what I did. I broke this thing down so that people can see. So what are the tests that actually determine whether there's stress going on in your body? I'm just giving a few examples here. Cholesterol, vitamin C, magnesium, RBC. And how can you tell if a cell is weakened or not? Well, the glycomark test will tell you 5 to 7 years whether you're at risk of diabetes before an A1C test will tell you anything. And
Wow,
so it's
that's powerful.
measuring your pancreas and your insulin receptors on your cells to see whether they're starting to deteriorate. And so this is by far the best sugar test. The omega-3 6 ratio, the vitamin D3 test, the D dimer test, which is a blood clot test, these are all showing weaknesses in the cells. And the
Mm,
challenge cells are the ones like the galactin 3, which is showing that fibroid is getting out of control. The 8-OHDD is a test of the DNA damage showing up in your urine. And so these are challenges, all right? And homocysteine is a challenge, and C-reactive protein for inflammation is a challenge. So these are all the tests the doctor should be getting for people in order to find these things 5 to 10 years before we actually have a heart event, before we actually have the system developing to the point where the heart is really challenged. And so then you see that it just goes on from there. The dysfunctional are just increasing the number of things that are going wrong to get to the disease point. It's like cells have accumulated too much mutation and have given up on the repair process. Remember, I said back in the repair process, they eventually give up.
right.
That's
Yes.
when disease manifests, when too many cells have given up and they're not really trying anymore to get this repair process underway. And so we need to identify these changes 5 to 10 years before conventional diagnostic tests. So that's why I stress these tests. We have to have
Right.
proof that this thing is working. And so when we do these tests, we can find out, is this prevention and treatment program working? The proof is in these 18 tests. We allow then functional medicine doctors to use nutrition and exercise and stress reduction, detoxification, acupuncture, nutraceuticals to help to prevent the disease and to treat it. We establish healthier lifestyles for both better long-term health and for cost savings in the avoidance of disease. So in the case of cardiovascular disease, this means doctors will be able to return more patients to higher levels of cellular repair in good health. That's the bottom line. We're gonna decrease the number of people who get heart disease, and we're gonna increase dramatically the number of people who can recover, not just partially, but fully from this problem, whether it's COVID
Hmm.
related or whether it's the damage we talked about earlier. This is the bottom line. This is what we want this protocol to be able to do.
Wow, that was a lot of information in a short amount of time, Doc, and we didn't expect anything less from you. I've read these articles of yours and made extensive notes, and this PowerPoint just put it all together really succinctly. So, well done, excellent. This is where you can contact Dr. Benz. He's been generous enough to give his contact information here, and this is a resource, folks, that you do not want to ignore because it's taking it to a whole new level. These 5 to 10 years prior to current diagnostic tests, if you take nothing else away from this presentation, take that. This is where you're going to start saving lives and prolonging lives. The diagnostic tests that are done today are too late. I mean, that's probably the big takeaway from this, right, Doc?
I think you just nailed it. And a lot of people don't want to know about these tests
Yeah.
if they don't have a solution to go along with it.
Yes.
If you give them both, the diagnostic tools to say, yes, you have a problem developing. And oh, by the way, here's the protocol that you can prove that you can
Yes.
stop this and reverse it. Then people go, okay, I guess now I'm in. I'm okay.
Yeah. Powerful, powerful presentation, powerful stuff. Doc, thank you so much. It's always a pleasure having you on. I'd like you to be a regular at these wellness weeks. So get something ready for May, okay?
All right. All right. I'll try my best. Thank you, Joe. I really
All right.
appreciate the
Thank you.
opportunity.
Pleasure, Doc.
All
Thanks.
right.
Well,
Bye.
everybody, we'll be back in a few minutes at 12 o'clock for our roundtable today. So take a break, stay tuned, come on back. We'll be back with Megan Purdy, and we're going to be discussing at the roundtable again, second time this week, Lyme disease. So we even learned some information from Dr. Benz on that today and the Epstein-Barr virus. So we'll